I'll go ahead and get started. Got noon on the dot. All right. First up on the agenda is approval of the minutes from December 17th. Anyone have any corrections or edits to the minutes from December? If not, I would entertain a motion to approve.
So moved.
Thank you. And a second?
Second.
Thank you. All those in favor, please signify by aye.
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 Any opposed? All right. Minutes are approved from December. And so before we go on to the rest of the agenda, I just want to thank you, Desi, for sharing your personal story with WDY and really being a pillar of strength in this community throughout the pandemic. Just wanted you to know how much we appreciate your leadership. And I think as we think about the pandemic and how it has really highlighted the importance of public health, public health is often in the background, just this unseen hero in the community. And the pandemic has really put public health center stage, and along with it, some really intense situations and decisions that had to be made that weren't always popular. And I think the Board of Health has played a much more prominent role than in these past 2 years than any other year before than I can remember. And I think I've been on the board at least 6 years. And I do know that boards of health across the nation can be structured differently and they can have different levels of responsibility, which really started to prompt me to think about maybe it's time to do a more thorough review of our bylaws and to see some comparisons and do some further research on how other counties and cities structure their boards of health. And so I don't think that we've done a deep dive, at least not since I've been on the board. And so I would like to appoint a subcommittee to focus on updating the bylaws. And so that focus of that subcommittee would be to do the research and make some recommendations back to the full board for consideration at a future meeting. So I would like to appoint Commissioner Preston and Lynn. They've been on the board the longest to help me with the review of the bylaws, and then we can report progress to the rest of the group. And if we don't finish recommendations by the next meeting, then certainly, like I said, we'll report progress. But at this point, I wouldn't anticipate any major changes, but I really think it's worth the focused effort. So just want to put that out there and let you guys know that that would be, I think, helpful, and more to come on that topic in future meetings. So Desi, didn't mean to jump in there and state that, but I think it's time to do that review. So thanks, Lynn and Arlette. I don't hear any objections to that. So I'm good with appointing you all. So, all right. Okay, Desi, you're next on the agenda.
Yeah, I'll talk about this one, and then I have one more thing to add as well. But
Sure.
Just to let you know, in December, we did a customer service training for our staff. And we had Matt Sanders from Fargo PD, who's gone through the Disney Institute and does a really, really nice training on customer service. And so part of that training was to look at touch points throughout our agency. And so a touch point really is a moment where you can either positively or negatively impact, a customer coming in, whether that's from your physical layout of your building, how people are greeted, lots of different things to look at. So one of the challenges we have with our building, although architecturally from the outside it looks maybe fabulous, but no one knows where the front door is. So we have a really interesting problem with that. So what we're trying to do is we're trying to look at ways to draw the eye to the front door, because it's kind of tucked in behind a very large brick pillar. And so we're trying to look at, is there an awning or something like that we can put that's colored that would draw people in? And so that's going to be something that we're trying to get some bids on going forward, just to look at, how we can make it easier for people to identify, okay, this is the door that I come in, so it will be more welcoming from the get-go. So we will keep you updated on that. But like I said, we have some ideas on some sign changes and just some colorful awnings to draw people in. We also have a staff door that's very well known to us as a staff door, but when from the outside, people look at that door and that's the only door they see from the parking lot. So they tend to think that that's the front door. So just so you know, we're going to be try to look at some logistics of our building and try to make it a little bit more user-friendly for those that are coming. The other thing I just wanted to add, I want to thank you all for being really tolerant of the virtual meeting format. I know that we have some really like it, some really don't, and thank you for kind of putting up with this. I'm thinking that in April, we are hoping to be back to an in-person format. And so that would then put us back down at the City Commission office again. We have to kind of talk with City Comms again and see how that will work. We may be going to a format where just the board is up at the dais and staff would be down below. We'll kind of see how all of that works, but just wanted you to know that that will be coming, and really appreciate everybody's willingness to participate whatever format we've had, and just the support that I've gotten and Fargo Cass has gotten from this group has just been really heartfelt. So thank you for that.
Very useful on days like today. All right. Okay. Budget. Melissa.
Hello, everyone. It's been a few meetings since I've been on. These meetings tend to happen on days I turn into a 3 or 4 day weekend. So anyway, so obviously 2021 was basically all about COVID, and we all know that. So I just wanted to highlight a couple things between 2020 and 2021. Our expenses for 2020 amounted to 11.5 million. The expenses for 2021 came to 13.4, almost 5 million. So the increase obviously was COVID related. The harm reduction was a big part of it. They went from, besides immunizations, that's a big cost, and the testing was a big cost, but harm reductions also went up quite a bit from 1.9 to 2.5. So our biggest increases were obviously due to the vaccines. We had more costs starting in July due to the guard leaving and all of the health department picking up the costs, the majority of the costs for the testing sites since July 1. That's been a big hit, but this was all covered by CARES or the ARP funding. The one thing I wanted to highlight on the statement of revenues for 2021 was the third party insurance, which is just over halfway down your revenue sheet if you're looking at that. And we had budgeted $430,000, and that is billing to insurance for all of our different programs. And the revenue so far for 2021 was 1.7 million. And 1.4 of that was vaccine reimbursement from insurance companies. So actually 1.5. So that's where that ended up. Obviously the programs weren't quite as busy. We were all focused on COVID for the most part. Those that were working in their programs, went along as normal, but we ended up with 2020 revenue at 114% over budget. And that mostly is because we really didn't do budget adjustments to account for the increases in some of those other areas. Obviously the insurance reimbursement. We finished expenses at 102% of the budget, which I thought was actually pretty decent. I thought it would be higher than that. And going into 2022, of course, we did the budget very early last year, and we are going to have some budget adjustments for this year, again, because of COVID starting out in January and continuing. Hopefully we're kind of on the downhill slide for that, except in harm reduction. That's probably going to continue a little bit longer. And again, covered by the grant funding we have received, but that's kind of where we're at right now. So any questions on 2021 or 2022?
And I will just jump in as well, just with some of these other items below under the budget. So Melissa talked about last year, our budget, we were having to push that through a little bit faster. It kind of sounds like that's going to be the same again for this year. We do have our director of finance who is retiring this year for the city. He is staying on with us to April 1, I believe. And so I know that the city would very much like us to get a lot of the preliminary budget things kind of laid out before Kent would leave. And so that's going to push us a little bit earlier to start having to work on some of these budget items. So we may be having to look a little bit like, you know, what did we do last year? What did we do the years before? Rather than, because we're not going to have as much time to maybe process and think about all of that. So just so you know, that's kind of what we're going to be looking at. I know that Human Resources has asked us already to, you know, they're going to do their market study that they typically do for positions. We've heard, you know, several times of certain jobs that, you know, have been much harder for people to hire. I know we've certainly noticed with our job postings that we get less and less applicants. You know, lately we've had a couple of OA positions. We historically, you know, years ago used to get 100+ applications for those. You know, we've gotten under 15 sometimes, under 10 sometimes. So it really is a very competitive market right now. There are several jobs that we're going to have to look at going forward. I know one that we've talked about publicly before has been the harm reduction advocates and the team leads in harm reduction, just because of the complexity of their job that they do and the competitive market that they are in, kind of that starter type positions. And so we may have to look at looking at increasing those positions as well. But just wanted you to know that we will be probably pushing through a little bit quicker again this year for budget. So, you know, we always do that budget meeting in May, and we may have much of it already kind of laid out by then. So if we need to, we will reach out to the board, you know, prior to that time. If we need some guidance or some recommendations, we can also do that. But just know we will be working on things a little bit sooner than we typically would.
Questions for Desi or Melissa on the budget?
If I could just add a little bit, Chelsea, this whole issue of staying on top of the wage changes in the community is an issue across the entire city structure. So we're already getting requests from various departments to make adjustments, and I think we're all fully expecting that to happen with the survey, the salary survey that will be coming hopefully mid to third quarter of this year.
Thanks, Arlette. Any other questions? If not, Desi, you can move into COVID, a COVID update if you'd like.
Yeah, and I think I'm going to have Dr. Newman start us off. She's just going to talk about some things that are kind of new and different with COVID, and then I can end after that with our operations as of right now.
Sounds good. Hi, everyone. I just have a few kind of hodgepodge reports. They're all related to COVID. I was going to update the board about the recent pediatric Pfizer vaccine. I'm sure you guys have maybe seen some reports of that in the media, and it's a little bit of a confusing story. So on February 1st, the beginning of this month, the Pfizer asked the FDA for EUA of its COVID-19 vaccine for children ages 6 months to 5 years. This vaccine is 1/10 of the adult dose. So you might remember the 5 to 11-year-old was 1/3 of a dose. Adults get 30 micrograms. That 5 to 11 got 10 micrograms, and this age range they're testing with 3 micrograms. So a really low dose. Pfizer initially sought approval of a 2-dose regimen while they were continuing trials looking at efficacy of adding a 3rd dose. The 2 doses are spaced out 3 weeks apart, just like the ones we're used to, and then it would be followed by a 3rd dose 2 months later after that 2nd dose. So the initial trial data with a 2-dose series did not produce a strong enough immune response in the older kids and kids ages 2 to 4 years, but it did show an adequate response for 6 months to 2. And there was no safety concerns in either age range. So it was kind of a weird conundrum. The way the vaccine approval process works is you can't skip age groups, so they couldn't just seek approval for that younger group, hence some of the confusion and some of the delays. And if Pfizer were to wait for the full data on the 3-dose series, it would take much longer. So some people were urging that they go ahead and seek approval just to get the process started, and at least the FDA could begin reviewing all of the trial data from the 2 doses. Part of that was because that during the month of January, especially, the US reported like the highest number of COVID-19 cases in kids since the start of the pandemic. We had more than 3.5 million new cases just in the month of January. As of February 10th, there was more than 12.3 million children that had been infected over the past 2 years. And then we are also starting to see a lot higher rates of pediatric hospitalizations during Omicron. So they initially did this, and then last Friday, just a week ago, the FDA announced they are now postponing this VRBPAC meeting that was scheduled for this Tuesday, and they would just fully wait to get the trial data on the 3 doses. To make sure that they're effective for everyone under the age of 5. So it's now expected those results will come in early April within a few week process for review or approval following that. So stay tuned for that. A little bit more about the pediatric doses in the 5 to 11 age range. The CDC released data this week just showing that those rates are really low. They fall into the lowest level since they were first approved. So our 7-day average in this country now of a first dose fell to like 37,000, which is the lowest it's been since November 2nd. In the United States, only 31% of kids ages 5 to 11 have started that vaccine, and only 24% are fully vaccinated. So really not the numbers we'd like to see. Of course, that's compared with 75% of the total US population having started the vaccine. I looked into our North Dakota rates, and for statewide, for 1 dose in that 5 to 11 range, we're at about 19%, 2 doses, 15%, doing a little bit better in Cass County, 31% for 1 dose and 26% for 2 dose. So that's probably on par with the national average, but just something to monitor. Also in the vaccine news, Moderna did get FDA full approval at the end of January. So it's now for 18 and older. It's now our 2nd vaccine for COVID-19 that has full approved vaccine approval. Novavax has submitted request for EUA for their COVID-19 vaccine. This would be a 4th vaccine on the scene, I guess. It's a protein-based vaccine for, again, adults 18 and up. Pretty good trial data. It enrolled 30,000 people from US and Mexico. They released an efficacy of 90.4%, which is fairly good, and a good safety profile. It's a 2-dose vaccine series again. So we're kind of waiting on some late stage trial testing of that for 12 to 17-year-olds, but that is in the works as well. So maybe potentially a 4th vaccine to be approved. Also of note, the CDC met 2 weeks ago. Their ACIP committee met, and they reviewed many topics. There was updates on immunocompromised schedules you might have seen. One thing of interest is they are considering extending the interval between the the mRNA vaccines. So currently, Pfizer is given 3 weeks apart, Moderna is given 4 weeks apart. They are considering spreading both of those mRNAs to 8 weeks in between. This is really an effort to lower the risk of myocarditis and to improve effectiveness. At that meeting, they reviewed some data showing higher antibody levels when they were spaced further and improved immunogenicity. So no final decision has been made on that, but that might affect what we're doing here at FargoCast, obviously. Also, a fourth monoclonal antibody drug, I can't ever say these, I think it's bebtelovimab, say that 3 times, is on the scene. It received emergency use authorization last week. It's made by Eli Lilly. It's been shown in the lab to be effective against Omicron variant, but we don't have testing or studies that can show if it can prevent severe disease. The FDA did approve it for emergency use. It said it should not be a preferred product and should only be used as an alternative treatment or when other clinically appropriate treatments aren't accessible. So these are sort of similar designations that FDA gave to the Johnson & Johnson vaccine and to the oral antiviral made by Merck, if you remember. Anyway, another thing, we were on a statewide call last night asking if North Dakota should expect shipments of this. As you guys know, all of these drugs have been very scarce supply. It sounds like North Dakota probably will receive this. We get weekly supplies of this to the state. So maybe look for that in the coming weeks, another option for people. It would be the same criteria we currently use for monoclonal antibodies, high-risk patients of a certain age, has to be given early on in the disease, things like that. Quick update about masks and tests. So the supply of free masks that we've been handing out at our main location at FargoCast Public Health on 25th, that has been depleted, which is good news. At this time, we are not expecting to order more unless we are able to get them from the state. FargoCast Public Health will not receive the federal N95s as those are allocated to the federally qualified clinics like family health care in our community. And they also go to various pharmacies that have federal contracts, but we will not be receiving those. Also, the Department of Health has distributed free at-home COVID-19 test kits statewide, and these are available to all citizens. There's no residency requirement. They're free of charge, and you can get up to 2 per household member. So we're really encouraging people to do that. FargoCast has these available in our main building, Monday through Friday, 7:45 to 4:30, and also at our COVID-19 test site on 25th Street from 8 to 5, Monday through Friday. And then one other thing to note, there's been some buzz in the media and things. The CDC, it sounds like, is planning to update a wide range of their guidance, including mask use in the coming weeks. It looks like they're going to shift to focusing metrics more on severe disease and hospitalizations rather than infections and case counts in communities. So obviously we will follow that and try to make local updates as soon as we hear more. I think that's all I have.
Okay, thanks, Tracy. A couple things to add to your comments. We did get a small supply of some more KN95s in. And so that's new, that happened yesterday. So we do have a small amount available so people can check here if they are in need for that. And the testing site, or the test kits, they have given out 13,000 so far, I believe, of the test kits. So our initial allotment was 35,000, I believe, and we can order more from the state. I think the state ordered 1 million. And so, and it's 2 per person per household to start, but then if people would go through those and need to stop back, they certainly are welcome to do that as well. But so those are just some updates from that. The other thing I just wanted to talk about, Suzanne had pointed out on my sheet when I put demobilization that might be confusing to some, so I want to clarify that I recognize that even though I put demobilization, I know that COVID is not done. When I use that term, I'm saying for temporarily, for now, as things start to slow down, we will start to get back to some normal operations, starting to look at, getting staff back to what they're normally doing, more of our routines. Right now we have still our testing site that's up and running. Numbers are decreasing rapidly there as well. I believe we have our lease through the end of March. It's my hope that at that time that we can kind of close up shop at that time, and that the home test kits that are available would be an avenue for people to continue testing within the community. Also the health systems, if they, have requirements for testing, or if you have symptomatic people, that they would go through the health systems, and that, travelers can then find avenues at pharmacies or whatever to meet their needs for travel. So we have the testing, we have obviously the test kits that we're distributing, and then we're still doing the vaccines within our clinic walls in our normal immunization program. And so those are the main efforts that we are still continuing with COVID. So we are kind of shifting people back towards their normal duties again. And so we have a lot of rebuilding to do. So when I talk about reinventing, it's kind of, we've put aside a lot of our routine programs for a long time, and they've been neglected a little bit because we've had to do that with staff diverted to other programs for pandemic response. So we have some referral building to do. We have some, looking at programs and seeing where needs are, and seeing if the programs we're doing still make sense for what the community needs are. So lots of things that we're going to be looking forward to in the next months ahead. And so, but also knowing that we also don't know what this pandemic is going to do. And I don't think any of us can predict that. So we know that if we have to remobilize and do different missions again, that we will be able to do that as well. And so right now it's kind of getting people back to where their comfort is and to their programs and building those up, but knowing that we will shift if we have to. So that's what when I'm talking about demobilization and reinventing, it's just kind of adapting and being flexible where we need to. But I think we all can probably attest that this pandemic is not over. So we're probably not done with it, but we're certainly happy to have a welcome break for everyone's sake, for mental health sake, for all staff. I think that part, if we can get that, will be really good for all of us. So happy to take any questions anybody has.
And I was actually just going to add that about the home tests, just so we're clear. They're only for 2 and older. Actually, some of them are designated to be for 14 and older, but anyone with a child under the age of 2 should still be going to their provider for testing.
And when you pick up those tests, they do ask you if you have anyone in your household that is under 14, so they can give you the proper tests to make sure that they're addressing all the needs within the home.
Questions?
I don't have a question, just a comment that I've said before, but I just want to thank the team at 25th Street. They have been unbelievably efficient. Unfortunately, I think we've all probably been through there a few different times, but it has been a fantastic resource for, quick testing, peace of mind. And I know there's been locations in the schools too, but that 25th Street location, they rock it. They've done a fantastic job. So kudos to them.
Thanks, Lanya. I will let Doug wasn't on this call, but I will let him know that, his team has worked. They've had their struggles and staffing has been a struggle, but they have, I will agree, the efficiency of that location has really been the mainstay in our community for quite some time now for testing. So they've done a really, really good job.
Other questions or comments?
This is Charlene Nelson. I have a comment, but I also have a question. The comment is, earlier this year, there was an invitation apparently to appear on Chris Berg's show, and it was declined. And I just have to say that I personally was very disappointed. I think, if we have the truth, it can be defended, and I was disappointed that was a missed opportunity. And then my question is, in your demobilization and everything, and since the CDC has stated unequivocally that the vaccine does not prevent transmission, will we have any kind of focus to address some of the other things that contribute to COVID, the seriousness of COVID, such as diabetes and obesity? Is there going to be any kind of emphasis on, exercise, good health, that kind of thing, so that as we deal with this long term, we have a more broad-based, well-rounded approach to this disease?
Yeah, and I think, thanks for the question, Charlene. I think with our health promotion division, they deal with a lot of the activity, obesity. We have programs where we start in childcare with activity and healthy eating and different things like that. We don't specifically have a program here that addresses diabetes, although they do have several within Cass County with other agencies that address diabetes. And we're also doing our community health improvement plan that will be developed this year as well, where we will develop goals and objectives based on the needs that have been identified within our community. And certainly obesity has been one, mental health, behavioral health have been others. And so we would be developing, along with our community partners, activities that will address some of those needs.
Okay, thanks.
Thanks, Desi. Any other questions? Comments? I'm just glad I'm not the only one that can't pronounce those antibody treatments, so I won't make you try it again.
I would like to add just one comment as well, too, for future agendas. If any of the board members have agenda items that they would like to see on the Board of Health, if they could send those to Chelsea for her to get them to us. I know that the next Board of Health meeting, we're going to have Brenton from the North Dakota Department of Health is going to talk about some of the STI rates that are going up in our area. And the pandemic caused a lot of focus, certainly on pandemic response, but maybe not as much focus on other things. And so we've kind of seen like our immunization rates and different things like that we used to have a pretty strong handle on. Some of those are starting to be impacted just because of that lack of attention to them. And so we've seen the same thing with our STIs. So we need to have some discussions on that. But if you have other topics that you would like to see, please get those to Chelsea, and we will put those on future agendas.
Yeah, definitely.
And Desi, thank you. I just want to make a comment real quick. I jumped on. And if there are other diseases, reportable conditions that the board members want, I say STIs, but we do have access to other conditions that are reportable. I'm more than happy to present data on that. And then with COVID from a state response, we are also starting to scale down. We did stop case investigations on Sunday, and we are discontinuing at 6 p.m. during the week. So we are also scaling down, just like many of our local counterparts. Just wanted to add that in real quick.
Really?
I'm sorry, this is Charlene Nelson again. And being new to all of this, I'm kind of curious now, to place an item on the agenda. When I read the bylaws, I thought that it said that those items had to be agreed upon by the board before they could go on the agenda, or what is exactly the process for getting something onto the agenda?
It sounds like a great reason to review the bylaws. But I think what we have been doing for, at least since I've been on the board, is you can certainly send him to me. Or, I'm sure Jesse can get it to me too if you send it to Jesse, and we'll look at the topic. But I think that's an area of opportunity for some clarity, as you pointed out. So.
Okay, thanks.
Mm-hmm. And I think from a data perspective, Brenton, anything that is been increasing significantly, I think is of interest. So calling out that one topic, but if there's other trends, that's always of interest, I think, to understand why and what we can do to support. So. Thanks
Perfect.
for
I'll
checking
look
in.
at some other conditions as well.
Okay,
And
excellent.
let Desi know and get in contact with you. Thank you.
All right, perfect. Any other questions? Otherwise, anybody at City Hall for any public comments?
It says in the chat, there's no one there for public
Okay.
comments.
All right, perfect. Thank you. Okay, then. Well, the next meeting is April 8th. And as Desi mentioned, it sounds like we may be in person. And so we'll be in touch on that. Otherwise, have a great weekend and stay warm through the blizzard. Okay. Thanks, everyone.